Hello everyone, I welcome you all on Homeopathy Musing. Today is the episode 7 of our series ABC of Remedy, where every month we discuss one remedy in detail. And in this episode, Dr. Preety Shah ma'am will be discussing about a remedy, Gelsemium. In case you want to catch up with the other episodes, it's available on our YouTube channel, Homeopathy Musing. We'll be providing you the link in the chat box. You can have a look. And before we proceed, I just want to make a quick announcement. Every year we conduct a retreat as a part of our karma. And this year too, we are going to be conducting animal retreat where we'll be studying the animal group birds amongst nature at Hidden Oasis Organic Farm near Pune, Maharashtra. The dates are from the 13th of December to the 16th of December. 2024. Apart from the animal group bird discussion and study, we also have a lot of activities planned for our participants, like meditative processes, yoga, bird watching, stargazing. We'll be providing whole plant-based meals. In case you are interested, you can just contact on the below number, or you can write to us on the email ID provided below. I will not waste any more time. I will stop sharing and I'll hand over to ma'am.
Perfect. Hi, everybody. I think I'm meeting all of you after a 2-month break, right? I think Prajakta took the last couple of sessions. So I'm glad to be here and talk about a remedy. So we've chosen Gelsemium as the remedy to talk about today. We've all studied Gelsemium, and I'm sure we've used Gelsemium at least a few times, if not a lot, in our practice, whether we are a beginner or a very experienced homeopath. It's a remedy without which I don't think we can practice, right? It is one of those remedies. So we'll start with the case, then we'll try and study the remedy and the group a little bit more in detail. Some aspects which often we overlook or we don't stress enough. So we'll try to do that. And then if time permits, we will end with another case. So we will see how this goes, organically, we will decide what happens. So I will share my screen now and let's begin. Okay. So this is one case. It's an old case. It was a reference by one of our assistant doctors in the clinic. I think she was a relative of hers. And she was roughly around 65 years old when she first came to us. And her chief complaint was, so to say, irritable bowel syndrome. Basically, she has had chronic diarrhea, chronic persistent loose motions. And because of these loose motions, and sometimes these loose motions were not necessarily due to only in the mornings or when they have to go out. Sometimes IBS presents with these type of symptoms, but for her sometimes it was without any cause and it could be throughout the day. And they used to come in like episodes, like over the past many years, she's had like diarrhea for many years together. Then maybe there is some relief, and then she would start with another episode. And they were loose motions that would cause weight loss. The stool was foamy and very offensive. And as you can imagine, she's taken a lot of treatment for it. She's tried a lot of medicines. At one point, she was also even hospitalized because this, the diarrhea wouldn't stop and she was like almost getting dehydrated. So the issue was that. And food would definitely play some role. So if she has some outside food, etc., or she would have to pass motion immediately after eating, etc. Um, she also had some comorbidities. She has diabetes. She's a known case of diabetes and hypertension. And one thing she stresses that the stool is offensive. Like, she would have to immediately flush the toilet because, for herself also it would be too much to bear. And she says it can happen anytime, mornings, after food, before food, but generally more if she eats outside food. Also, if there's any nervousness, like if she's nervous about something, like for example, if she has to go to the bank, of course, it would be more. She said, I had to come meet you today to the clinic, and before I left my house, I had to go past motion. Like I would, oh my God, how am I going to arrange everything at home? How will I catch the train? How am I going to reach there? Will I reach there on time? So a lot of anticipation. Okay. Um, she said that she began by saying like her mental and emotional history. She began saying that I've had a lot of losses in my life. Like I have lost my husband when I was very young. My children were very young. She's a mother of four. And just some time back, I also lost my eldest son. And he was, barely 40 years, not even that. He has a family of his own, young children of his own, and I lost my child, and this has been too much. At this moment, there is no stress, but sometimes I can't sleep the whole night, and then the next day I'm very irritable, and then everything, I get angry on small things, and then food can cause a little trouble, etc. Yeah. She says it was when my son, so her eldest son, he had a sudden heart attack. So he was traveling, and he was at one of the railway stations about to catch a train, and suddenly he had sudden cardiac death, a cardiac arrest. And she said it was a shock, and I felt numb. Like within 30 minutes, like barely 30 minutes, he just passed away. We couldn't do anything about it. And she said, there were nights where I couldn't sleep. And of course, this was too much. This was too deep a grief. And she says, my husband passed away similarly, in the same manner. Like, he suddenly, all of a sudden, um, he was gone. We were not prepared for it. We were not expecting it. It was not like he was chronically ill, and, we knew that this is something that could happen. And I felt like a part of my life, a part of me was taken away. So, just if anybody could write, what are the key words? What are you hearing again and again? Anything that is striking to you? If anybody, like a few of you, can write on the chat, just communicate with me. I think I'll be very much interested to know. Did you pick up anything, any language, which you thought was significant and repeating? Grief, loss, okay, okay. Anticipation, yeah. So grief and loss is important, and it came twice in her life. So this is very good. This is important. Uh, and then anticipation, yeah. And there are a few people who are saying sudden and shock. I think that is very important, because she said I was not prepared for it. Suddenly I felt numb. It happened suddenly. He was going to work on the railway station, and suddenly my husband went away suddenly. So this sudden that happened, it repeated twice. I think that is very important. And anticipation is definitely important. What does anticipation mean, anybody? I mean, you could take it as a symptom, as a rubric. You could take a lot of symptoms already, anticipation, anxiety when time is said, etc. But what does it mean? What does anticipation mean? Very good. I'm really numb. She went numb. That's also very important. Yeah. Anticipation. Yes, Narcissa. Absolutely. It's a miasm. Which miasm? Yes, psychosis, anticipation. Like I'm all the time anticipating something will go wrong, something will go wrong, or will I be able to do it? Anticipation is very, very psychotic. Yeah. So we have some hints already. We have was we have some hints of the miasm, we have some peculiar symptoms, the stool is very offensive, etc., etc. And this sudden grief or sudden loss, suddenness is important. And then ailments from loss of family members, ailments from loss of child, death of child. That's also a rubric that we could take. Yeah. So we have quite a few things already. By now, for the experienced eyes, you already know the rest. Hmm? One of the remedies that come to mind is ignatia, no? Loss, grief. Yeah, one could think of ignatia like, yeah. But we are studying Gelsemium, so I'm sure you can understand we are going to in the end reach to Gelsemium. But you need to catch this. What is this suddenness? From where it is coming? What is this numbness? From where it is coming? What is this diarrhea and loose motion? From where is that coming? And chronic and repetitive coming again and again. From where is that coming? Hmm? Okay, let's go ahead. He said, I couldn't sleep, I couldn't sleep through the night. I would sit in the balcony. I would constantly feel that he's going to come back. I felt anxious. And then, I felt that everything is over. There is no point in living. It was like an impending doom. Like I had lost all hope in life. Like imagine your young son was taken away, and only a mother can understand this pain. And yeah, I mean, grief, loss, it's, everybody will react differently, everybody will perceive differently. But this basic loss of husband, loss of child, there will be some common elements. But look at the way she's saying. Huh? Look at the way that only the mother can understand that pain. It was so sudden. Suddenness is coming again. So a little bit sensitivity you can see. She's not saying what I will do without him. Now all my support went away. Is she saying that I didn't know like what else to do? Like, now I became insecure. Who's going to I mean, that's not her focus. Her focus is suddenly that happened, and I felt that pain. This is the plant language. This is not the mineral language. Yeah, this is very plant like. This is also something that you can pick up already. So she says, my husband passed away when I was 35 years old, and it felt like a shock. My husband's passing was a significant event. And a lot of times when you reach to this level of sensitivity and sensation, you want to go deeper. And the idea is, how can you go deeper? How can you elicit the sensations? When you say that, how did it experience? How did this loss or grief or this news or this suddenness or this shock, what was the experience of this in your body, in your head, chest, abdomen, and legs, right? So she says, I could feel it. There was a lot of discomfort. Suddenly, businesses, shops, everything closed down. And she said, for 3 years, hmm, for 3 years, I had severe loose motions after my husband passed away. So you see this psychosomatic, something that happened, some grief, some incident, some psychological, mental, emotional factor, which had an immediate physical reaction. This is also ranunculaceae like. This is more like a plant feature, this strong psychosomatic, like sudden shock, sudden news, sudden grief. And then I had these loose motions. So this also gives an indication of the kingdom and also of the family. You could think families like ranunculaceae, you could think of families like Loganiaceae, to which Gelsemium belongs. She says they used to give me injections and they used to make me sleep for 6 hours. And it was like passing very thin water. My children, they had to take responsibility sooner. And then, of course, she says that, when there is a celebration, when there's a family get together, and all these memories come back and everybody celebrates together. But I don't like to go. I don't like to go to these kitty parties and get together. And I wouldn't go alone, especially, I will need somebody to come with me. So, a little bit about her nature. She says, I stay busy with work. I don't have time to, waste. I am all the time on the go. My daughter-in-law, she's working. I just have a little bit of an afternoon siesta. But in general, like I'm either cooking, I'm knitting, I'm sewing. I'm passionate about all of this. I can't sit idle. It feels like a waste of time. So she's a very active person. Currently, she says that I don't get very angry. My nature is generally calm, but there are moments when I could become irritable. She goes to this some spiritual religious group in Radha Swami, and they teach us what is the importance of doing good deeds and how one could attain moksha, enlightenment. So a lot of this is, conditional. Yeah, it's not very deep, but it's like that she's trained. Okay, that you should do good deeds, you should not get angry, you should not not be irritable, and things like that. And then she says, I don't like outside food, but I enjoy eating everything else at home. I do a lot of household cleaning. I wash my clothes by hand. And she says that, I wouldn't want to use the washing machine. It's not that they can't afford a washing machine. It's not that they can't afford house helps. It's very common in India to have house helps. But she says, no, I like to wash my own clothes. And it's different, when you see clothes that are hand washed versus machine washed. I'm on my feet all day. I love to work it, and my work needs to be perfect. I'm not in hurry anymore. I'm 65 years old now. It's not that I have to be like, she's not hurried and, like doing one thing after the other. She's not ambitious, but she's like, I like to work. I like to, make sure my house is clean, everything is perfectly done. Um, I watch news, I watch TV serials. Everyone likes my personality. I stay cheerful and happy, and I'm surrounded by people. Any fears? She says, no, no fears. We listen to satsang in the evening, which are these, spiritual get-togethers, and where they sing a lot of spiritual songs. And so again, this is compensation. Yeah, this is not really what she is saying. So you have to also see what's behind the words, right? And then no specific dreams, and whatever. There was some not very peculiar physical generals. And then, of course, Gelsemium was given. She did better. She did better. She continued to do better. And she stopped treatment after some time, and she came back in 2022 for some arthritic pain. She received some, a retake was taken at that time. And then the idea of shock and grief was not coming. That state had changed. Gelsemium had really acted very deeply, and the loose motions were very, very infrequent. And the state had changed. And then the next time when the consultation was taken, she was given lactifluoratum, which significantly helped her. So this is what our remedies can do. Uh, it can heal people from a lot of trauma, from a lot of chronic grief, which is so much hidden in the subconscious, and it has so much effect on our physical well-being as well, not just mental well-being. And no amount of allopathic treatment and nothing would have helped her. Only her peculiar her her simillimum could help her. Yeah. So we spoke about the plant kingdom, right? We also spoke about the family. The idea of Loganiaceae is sudden, numb, shocked. All this is the idea of Loganiaceae family. And this compensation, I have no fears, and a lot of anticipation, a lot of denial. is all psychotic. Within Loganiaceae, Gelsemium is a psychotic remedy. Um, how do we confirm that which subclass or which superclass this is? Yeah. So in this case, if you see that she comes from a actually she's a Marwadi. She comes from a Marwadi family. Um, uh, so traditionally in India, this community, especially, she's 65 years old, so she's from another, like, another generation. Generally women are not well educated, and they don't go out and work, etc. But this female, despite all the ordeals she faced, she never once said that, oh, I'm dependent, I can't do anything. She was not on the left side. um, and this idea of being busy, making sure the house is perfect, etc., there were elements which kind of confirm that she's on the right side rather than the left side of the plant chart. Yeah. There are no very clear elements of, there is no element of fear and, what do you say, fight or flight, or things like that. But some hints one could get from a subclass or a superclass perspective. Some rubrics. So if you see rectum, diarrhea, grief after, you have only 12 remedies in complete repertory 2021. And you will see Gelsemium there in 3 marks. Mime, death, elements from aggravate, child of, so specific, of child. And out of the 19 remedies, there's Gelsemium. And then, of course, death, ailments from loved ones of. It's a bigger rubric, but you see Gelsemium there. And rectum, diarrhea, excitement, emotional aggravates, you see Gelsemium in 4 marks. So you see, from a concept perspective, from the keynotes perspective, from the rubrics perspective, we can see the whole totality emerging. Okay. How does one differentiate in this case, especially because one could chronic grief, one could think of Ignatia. Why not give Ignatia, isn't it? um, uh, in Ignatia, the pent-up emotion, silent grief is more than Gelsemium. Yeah. But this psychosomatic, you know, uh, ill effects of grief and causing either paralysis, causing either diarrhea, causing tremors. This is more so in Gelsemium. Okay. Ignatia, the miasm is cancer, and Gelsemium, the miasm is psychotic. And we need to remember that all of these remedies in Loganiaceae family, from strychnine to curare to nux vomica to Ignatia, have this similar idea of grief and ailments of sudden loss and death, etc. It's also there in nux vomica, not just Ignatia. It's also there in Gelsemium, not just Ignatia. So, oftentimes we would prescribe this Ignatia rather than looking at the whole idea of this family. Okay. So with this background of the case, let's study the Loganiaceae family and Gelsemium a little bit more in detail. My battery is going to die, so I will need to go grab a charger. So you'll have to pardon me. I'll quickly grab a charger. Right. So I will share my screen once again, and let's study Gelsemium. Okay. So this is the plant chart. So Yaki uses the Cronquist method. And this chart was further then, from a personal evolution method. Dr. Gandhi did a lot of significant work using this same classification. And if you see here, Loganiaceae, it belongs to the order Gentianales, comes here. So this is subclass 6, Asterids of the plant family. And Loganiaceae belongs predominantly in the anal stage of development, row 3. So column 6, row 3 is where Loganiaceae lies, in which there is Gelsemium. So the main idea, if you see here, um, of Loganiaceae, the entire gentianales actually is of shock, sudden shock, the idea of feeling shattered. And then, of course, it has a lot of families, including Apocynaceae. But Loganiaceae is the remedy which has family which has curate, Gelsemium, Ignatia, Noxomica, Spigelia, Strychnine, etc. So, anal stage of development. Uh, then I think we'll skip all these slides and directly go to the idea of what is subclass 6, okay? Because before we go to the family understanding, the idea of subclass 6. So subclass 6, again, let me keep here on this chart, on this slide where we have the column. Yeah. So if you see from the left to the right of the chart, the left side of the chart is more feminine and the right side of the chart is more masculine. Another idea is that as one goes from the left to the right side of the chart, the ego becomes more and more developed. By ego, I don't really mean egotism. By ego, I mean my sense of individuation, my idea about who I am and what my role is in the society. Okay, so I become more and more separate, more and more independent, more and more individuated. So this is the journey from left side to the right side. So in subclass 6, the ego is at its peak, and the idea is that it's me and the world. It's me versus other. Me and the world are separate. In subclass 1, the idea is that my border is so weak. My sense of separation of the world is so weak that it's difficult to differentiate between me and the other. Yeah. It's like I'm so clingy or everything penetrates. Yeah, so for example, Asaram, which is a remedy in the subclass 1, even the noise penetrates. It's as if it goes in my skin. So the borders are very weak. Any news, any emotion, anything just penetrates, and I can't separate me from the other. But in subclass 6, there is a marked distinction between what I am, who I am, versus what the other is. And the idea is different families in the subclass 6, as you go from top to bottom. The idea is what is my relationship with the world? Is my relationship with the world of that of competition, of war? It's my relationship with the world that they are doing this to me, they are taking away something from me. Am I in danger with the world? Or is my relationship with the world that I am the domino. I am the one who dominates. I am the one who is going to make them, show them what their place is in life. Or is my role with the world is that I want to take responsibility of the world. I want to do for them. I want to create something. I am full of ideas and I want to change the world with all these amazing ideas. One something that you would see in example ABAT family, or I feel that the world is injuring me, is attacking me. The idea that you would see in compositive family. So, what is my role? They could be, philanthropists. They could be serving the world. They could be taking care of the world. So, it depends on what their perception, which family, what stage of development they are. But what I want to stress is that the idea is about me and the world, me versus the world. They are more masculine. By masculine, I mean not by masculine, it is that I will go out and do something. I'm not a carer and nurturer. but I'm more a provider. I'm more of the one who will lead. I'm more of the one who will take up the responsibility of earning money, or making sure the name of my family goes ahead in generations. The world knows me. I can advertise my business. I've taken over the business from my father, and I want to put in different strategies in the business. Make sure it's on social media. Make sure we are, merging with other companies. Make sure I'm advertising everywhere. So the idea is expansion and taking forward. Okay, so this is the idea that we are talking about. Yeah, so a lot of female who belong to the subclass 6, their masculine energy is more predominant. So you will see a lot of their affections are like infertility, and things to do with where the feministic ideas are a little bit more suppressed, or not taken care of that much. It's not in harmony, so to say. So this is one way of understanding, from a subclass perspective, from an evolution perspective, from the developmental stage perspective. Now, if you understand this from the lens of superclass, so subclass 6 belongs to superclass 6. And the main idea that Dr. Sankaran talks about is that this idea of sudden danger. He stresses that this sudden danger is not just present in Solanaceae. You don't just see it in Stramonium, but this suddenness runs through the whole subclass. It runs through the whole superclass 6. So one idea is sudden, second idea is danger. So he says that the idea of me versus the other, there's a perception of danger. It's most predominant in Solanaceae, but it's also there in Compositae, where my perception is that I'm going to be attacked, I'm going to be injured, etc. And the reaction is, depending on which stage you are, the reaction could be that of complete paralysis. You are bedridden, completely, like apocynaceae, for example. Or it's like fight or fright. I have to run away. I just can't. I have to cling to somebody, even if it's a furniture. I need a small child in the house, like one would imagine in Stramonium. Or one could also imagine in remedies like Chamomilla or Cinna, etc. So the idea of sudden, idea of danger and fear, and fight or flight. I'm going to fight like Nux vomica, or I'm going to just run away and collapse or cling, or things like that, like so many other remedies that we know. So he stresses a lot. This is the DNA of superclass 6 that he talks about. Okay, so this is the background. Now let's just focus on Loganiaceae for today. So where is Loganiaceae? Yeah, okay. So Loganiaceae, predominantly anal stage of development, which is the toddler stage of development. The main sensation is that of shock, let down, disappointed, turned into pieces, shattered, ruined. Shock is so sudden that it could paralyze. Okay, it runs through the family. And the reaction, passive, could be paralyzed. I cannot move. I don't know how to react. I'm completely gone numb. I can't even weep, faint, or active reaction would be they are so beside oneself, like Nux vomica. Yeah. So Nux vomica has a lot of more, very excited, very agitated, always, always the nerves are so raw, and, there's a lot of tremors and convulsions and things like that. And Ignatia, Gelsemium would have more like a passive reaction. And the compensation could be that they are very calm, very composed, very happy to be around. Other people think that you're very calm and cheerful and happy to be around. So everybody likes her, just like our patient. Yeah. So it's a very compensated state of being. Yeah. So sudden collapse, sudden paralysis. Okay. So this is a picture from a very interesting book by Dr. Sankaran. So, all the plant families are depicted pictographically. So you see all this, no? Shock is so sudden that it paralyzes. So the ailments from could be disappointed love, bad news, even happy news. like big birthday surprise, and they're like, oh my God, I don't know how to tolerate. There are so many people who don't even like happy surprises. Sudden news, sudden surprises, anything unexpected, it triggers them. Yeah. So you could think of remedies like this: death of a child, sudden painful loss, insult, humiliation, anger with fright and shock. And the experiences that I'm completely shattered, shock, I cannot move, I'm devastated. It's heartbreaking. It's like doom. I don't know. I can't see ahead. My life is completely ruined. There is no point in life. Yeah. Completely gone. Or I'm completely amazed, astonished that how could this happen? Yeah. And then, as I said, there could be lots of convulsions, cramps, dizziness, nervousness, always edgy, or they would completely, faint, paralyze, be depressed, be sad. They are, they lose hope, etc. So this is the main idea of the Strychnine family, which is Loganiaceae. And then, if you look at some of these rubrics, if you look at generalities, paralysis, excitement from, you have Nux vomica, Gelsemium, Ignatia. And then if you look at uh, ailments from grief and cannot weep, out of the 13 remedies, you also have Nux vomica there, you have Gelsemium there, you have Ignatia there. It's very interesting. We only know of Ignatia, but in 13 remedies, you're seeing Nux vomica and Gelsemium. Paralysis, which is both at a physical and mental level. If you study Gelsemium, the stress is that the paralysis is functional. The motor nerves are affected, but the paralysis is functional. It's not pathologic. It's not because of some tumor there in the brain. It's a functional paralysis. What do you mean by functional? It's some motor neuron affection, or it could be a post diphtheria, after this infection that the paralysis lasted. Effect is sudden, shock, disappointment. If you look at paralysis from mental shock, out of the 6 remedies, you will see their Ignatia, you will see their Nux vomica, and of course, disappointment, deception aggravates. Somebody, they just cheated me, they took a ground below my feet, it just completely went away. You see Ignatia in 4 marks. We had one case which I can share here at this moment. This was a case of Nux vomica, case of psoriasis. And this gentleman, he was a businessman, and he came to us, and then he said, like, his main complaints started or were aggravated that he had this big like a multi-million business, and he was one of the partners. And as one of the partners, he was working outside India somewhere, I think Africa. And what happened is, suddenly the partner said that, you know what, we want to kick you out of the business, and we are going to take it from you. This person, our patient, he was handling the business development part, so he was not actually working in the factory and looking after the operation. So he used to travel for prospective businesses and developing the business further. And he said, it was such like behind my back, suddenly they took this decision. I had invested my time, my energy, my money, my life to this business. I gave everything to it. It grew so much because of me. I was shocked. I was so shocked. I couldn't believe it. But then what I decided I'm not going to, let it go so easily. I'm going to fight for my right. I'm going to teach a lesson to them. I'm going to start the same business in the same country, in the same city, and I'm going to compete. I'm going to make sure that all these business leads that I had gone to, I will go and meet them and tell them that I have started this business. I have separated from them, and I started from scratch and built it up. This is typhoid miasm. So the same sensation of sudden shock, disappointed, somebody deceived me. It's all like subclass 6, superclass 6 of like Loganiaceae. But the reaction is not like Ignatia, not like Gelsemium. It's an active typhoid miasm reaction that I will do come what may, and I'll make sure that I grow the business from scratch. So this is the main crux of suddenness that can come and show or manifest in different ways. Okay. Then shock, anger, and disappointment, sensation of shattered, as if I've broken into pieces, both at a mental level and an emotional level. I think we already spoke about no death ailments from child. You see, the remedies that from Loganiaceae, ailments from death of parents or of friends. You will see our remedies. Sudden bereavement, ailments from bad news, ailments from anger, vexation, fright, shock. That this suddenly, I remember this one very old patient. The problem was that she entered into her classroom, a young girl, and then they suddenly, they kind of caught. She felt I felt I was cornered, and suddenly they, they insult. I mean, the remarks that they made for me, I felt insulted. I felt humiliated, and the idea was that suddenly they did this to me, and then all her symptoms had begun. So sudden was important, but also what was important was that I was this vexation, it was like as if I was insulted, I was humiliated, and I was so angry, I was besides myself. So that's also another thing. Some other rubrics, if we see, fear injured of being shocked in traumatic, one remedy, Gelsemium. And shock stunned, you see these remedies, Gelsemium, Noxomica, Ignatia. And then, of course, we have a lot of other rubrics that you can see, ambition loss of, after disappointment, you see Noxomica. So lot to do with ambition. Ambition is a big word for subclass 6. I want to go ahead and achieve something. I want to be the best of the best. I want to, you know, make my name, my fame, my position, etc., etc. That's a very subclass 6 feature. Selfishness, egotism, self-control, loss of. I want to stress on this rubric. Self-control, loss of, you see, Ignatia, Noxvomica, Spigelia. I want to stress the idea of control. And for those who are following and have studied the personal evolution method, control is a very anal stage word. It's an anal, very, I have to control my anal sphincters, otherwise they'll become loose and I will have, diarrhea or, things like that. So control is a very anal stage feature, which is a row 3 feature. It is where Loganiaceae belongs. And you see Loganiaceae remedies there. Loss of financial aggravates. You see Ignatia, Noxvomica, and if you expand this, you will also see Arnica there. So you will see a lot of subclass 6 remedies. Sudden loss financial will aggravate. So this is also something which is very interesting. And then lots of fears. If you look at Gelsemium also, fear something will happen. My heart will suddenly cease to beat. This is one of the key rubrics that even Dr. Sankaran stresses time and again, that it has to constantly move from here and there. Otherwise, the heart will cease to beat. Something bad will happen. Some evil will happen. I will go mad. And so you see a lot of this, lots of fears, etc. And then this idea, and that I want to, this idea of kill, like fight or fright is a superclass 6 feature. No? So if you see a lot of killing, a lot of violence, you will see a lot of these features also, where you also see Gelsemium in 1 mark. But what I'm trying to say is that in the subtleties of things, you see this whole, that the whole group has this idea of fight or flight. Escape desire to jump suddenly up from the bed, springs up suddenly from the bed. So escape desire to, one would think of Solanace, in general, you will have remedies like belladonna, stamonium, and mandragora that you would think of. But escape desire is also part of Loganiaceae, yeah? Sudden manifestations, you have a lot of these Loganiaceae remedies. So suddenness, a fight or fright, all of that is not just, Solanaceae, but a lot of other families belonging to the column 6. So anal stage of development. What is this anal stage of development? So the idea of personal evolution is that what is my inner age? What is my inner, so, I may be X, whatever, biologically X age, but inside, how do I feel, perceive, and react? Not just react, cope. What is my coping mechanism? That also kind of defines my, inner age. So, for example, if you study a toddler, from Eric Erickson's perspective, what is the main lesson, life lesson or evolutionary lesson, or from a perspective of what is the milestone a toddler achieves? The milestone that the toddlers, from a psychosocial development perspective, the milestone that a toddler achieves is that the first time a child is developing the sense of doership. He's afraid to fail and he wants to be in control. It's the first time that they are potty trained. Hmm? It's the first time they're going to begin to walk. They're going to find it difficult, but it's the first time they're going to begin to walk. So this idea of doership, the idea of having control, is an anal stage of development, and that's where Loganiaceae belongs. Now, this anal stage of development, one must also differentiate with the cancer miasm, right? Because cancer miasm also has a lot of control features, a lot of, that I'm going, but the main idea in cancer miasm is that the task is beyond my level and things are going out of my control and I need to make a superhuman attempt to keep things together. Yeah, which is a little different. There's actually sun and moon. It's quite, while it's the idea is control, the word control you hear, but it's like it's going out of control and I have to make all efforts to make sure everything is in control. So that's Ignatia within Loganiaceae, cancer myself. But the whole family is, that I want to be in control, I want to do, I can do, and to have self-control. In this woman also, no? I want to make sure everything is perfect. I want to clean everything. I want to hand wash things and then lose control. Diarrhea, the sphincters are not in control. Yeah. So this is the miasms from a miasm perspective, how you can differentiate each remedy. So we have Gelsemium, which is psychotic. Let's study some key points of Gelsemium. So main idea is confidence, want of self. They can be cowardice, they can be timid. We know all this, right? Timidity appearing in public. Fear that they will lose self-control, dullness, sluggishness, and clinging to people, clinging to persons, to, child grasp the nurse when carried. So a lot of clinging. If you read part of Materia Medica, the main idea is the affection, the sphere of affection is muscles and motor nerves. And in the muscle, there's a lot of aching, lot of tiredness, lot of heaviness, lot of weakness and soreness. And that's why we prescribe Gelsemium for so many fevers and influenzas and flus, right? So this is one. So muscles is one sphere of action. Second sphere of action is motor neuron system. Yeah. So there's a lot of functional paralysis and tremors and twitchings of single muscles of face, chin, tongue, whatever, one-sided paralysis, post-diphtheric paralysis, and the idea of never well since flu, it has this muscle weakness, dullness, drowsiness, achiness, soreness. And on the other side, there is this apathy and tired feeling and trembling, etc. So never well since is another important rubric. Ill effects of fright, fear, depressing emotions, anger, bad news, unpleasant surprise. That's Gelsemium. And Boric says emotional excitement, fear leads to bodily ailment. So this is very important. Words from emotions, dread, shock, ordeals. What is ordeals? Anybody? Prolonged, some stress, some bad things, too much, but prolonged, goes on and on for a very, very long time. So that kind of affects them a lot. And they're better by sweating, profuse urination, being busy, mental activity, mental efforts help them, and reclining with high head. That's also important. It's a psychotic remedy. We spoke about it. So lot of anticipation, lot of avoidance. Yeah. I have to keep control when going through ordeals. I have to be able to withstand difficult things, trying situations. I have to be able to withstand shock, and bad news without losing my control. And what they will do, they will put all their energy in making sure they avoid shock, making sure they avoid disappointment. They don't want to go to exam. They don't want to do a lab result. They will avoid going to the doctor. They will avoid going to the hospital. And when they have to go on stage and speak, or they have to go catch a train, or when there is an appointment, they have to go fast motion. Yeah. So this is the classic picture of neurosis, no? And neurosis is psychosis in homeopathy. So a lot of anticipation. We already spoke about it, no? Also, very good remedy in people who are singers and public speakers, and before going on the stage they have to constantly go past motions. Anticipation before going to a physician, before an exam, etc. Anticipation with lids falling. So a lot of, I mean, this is a remedy for anxiety neurosis. I can't count the number of patients suffering with anxiety neurosis which we have given, and who have helped with Gelsemium. So a lot of anxiety during anxiety in the heart region, anxiety with heart complaints, anxiety with gut complaints. They have to be restless. They're constantly moving. At this stage, let me give you another case example. So this patient of ours, he's one of the, what do you say? He's a general manager at in hospitality, in a very five-star hotel industry, and so at a very good position, etc. And he came to us with anxiety neurosis and panic attacks, and the chief complaint started during COVID, when his mother was admitted to the hospital. His mother was admitted to the hospital, not for COVID, but she had some, I don't know, stroke or something like that, or she had a fall. I don't quite remember. But she was in the hospital for a very long time. Hmm? It was not like for a few days or a few weeks. It was a very prolonged hospitalization. And his complaints and anxiety started with, what is going to happen to my mother, what is going to happen to my mother. The whole day he would sit in the hospital, and he would also work from the hospital, so he would carry his laptop and he's working. And then in that ward of the hospital, very severe, I think the mother was in ICU for a very long time. So a lot of, there will be like, people are going in and coming out, and a lot of bad news. A lot of people are not surviving. So a lot of deaths in that ward. So constantly I see people going out on stretchers, and I'm always anticipating that, is my mother going to survive? What is going to happen to my mother? What is going to happen to her? And the whole thing was, I'm hearing this ambulance sirens and full day. So he was on his nerves. And the main idea was, which I had completely missed, I had to refer this patient to Dr. Sankaran. Uh, this idea was a lot of anticipation, lot of anxiety. What next? What next? And this ordeal, which lasted for so long, prolonged hospitalization and anxiety. And then and the mother did not survive, and she passed away. uh, then this anxiety and panic attacks would trigger at any moment, especially when he was in closed rooms, like if there's traffic and he's stuck in traffic in his car. And in Bombay, traffic could be like, you are stuck in one place for sometimes even for like half an hour or more than that. So then that panic attack would trigger, or he couldn't go watch cinema because the theater will feed a lot of claustrophobia. And at night this anxiety would be more, and he would feel this anxiety in the heart region. So god knows how many cardiologists and ECGs he must have done, all the investigations. So very typical neurotic feature, no, that is this a heart problem, my arm is, the pain is radiating, etc. A lot of heartburn and acidity, lots of palpitations. And one another symptom he had was that he would have to get up middle of the night, and then he would, he did not really want to disturb his wife, so he would go out and he would constantly pace in his living room, and that would somehow help him. So he had to constantly be in motion. If you look at some of the rubrics, you will see anxiety walking on or after, or anxiety walking or motion aggravates, you will see Gelsemium. But you will also see Gelsemium that, if I don't move, my heart will stop beating. So you see both polarities somehow in Gelsemium. But constant pacing, he had to pace. Mm, Coincidentally, he lived in, my society complex. So sometimes post dinner, when me and my husband would go for a little post dinner walk, very like a stroll, I would see him, running and jogging, like, at 9 o'clock, 10 o'clock in the night. He would, constantly, like, he was very fast paced that way. So, one idea was this whole anxiety picture, anxiety neurosis picture. Second idea, which I said, was anticipation. Yeah. So, you get a lot of hints from there. Um, Another key element that I wanted to say was this idea that you know, sudden, I mean, that sudden news, suddenly my mother, she was no more, etc. But for example, in one portion of the case taking, the idea was that he is in one department of the hospital, whatever hospitality industry. So every morning they have these morning huddles, sorry. And they would all meet and kind of gather, this is the target or this is the plan for the day, etc. And people from heads of all departments would come and discuss. So on one fine such morning, one of his colleagues from another department with whom he was very, he was a pal, like he was a good colleague and they used to get along very well. He suddenly kind of made some remarks saying that our patient's department is not doing well and the colleagues in his department are doing a shoddy job in some way. And he said, I felt backstabbed. It came from nowhere. I was not given any intimation about it. There was no email that came about it. And, suddenly in front of everybody. So the idea of suddenness, even came there. That suddenly his main idea is that how dare he, without giving me any pre-signals, pre-warnings, in front of everybody, suddenly he's making these remarks that was not acceptable to me. This was one thing. Another thing which was very interestingly that came was that, he gave this history where he was this, he had studied and then he saw some newspaper advertisement when he was very, very young. And advertisement said that in the Taj Hotel, they are going to have this open interviews and everybody is welcome. Anybody who has studied hospitality, who has not studied hospitality can come. And there's this internship program where they are going to train, teach, and then employ them. So he was very happy. He went, and in this open interview, there are also these group interview sessions, right? So a lot of questions and interactions, and he participated very well. And then after the first round, like let's say there are 100 people in the room, and there is this group activity, and then after that, they select that okay, these people you can go home, and the rest will move to the second round. So after the first round, our patient was asked to go home. And he said, I was shocked. This came out of nowhere. I had participated well. I gave genuine inputs. I was very creative. And I felt shock. And I was pacing when I went home. I couldn't take this. And then what he did was, he went home. He couldn't sleep the whole night. He wrote a letter to the management of the hotel saying that, I don't think the interviews were done. I don't think they were not done well. I don't think I was given a fair chance. And he said, I'm going to fight for this. So this letter went. He was, he didn't know whether he's ever going to get a response. And then one fine day he gets a response, and the responses that come, meet us. I would like to meet you. And he goes with full anticipation and excitement that wow, this is good news. Maybe they're going to take me. Like they're going to give me a chance. I'll be given a chance to interview, and maybe things will turn out well. And he's waiting there, anticipation whole day. It was quite dramatic the way he said this. And so what he said, he's waiting there at the hotel. And when he was on the way, it was raining. He had not carried an umbrella, so he was all drenched in the rain. But he was sitting there, with all wet. And then after waiting for a few hours, he asked somebody that, I'm come to me. I had a meeting at this time with this gentleman. He said, but he's already left for the day. So the whole day he's waiting, anticipating, I'm going to meet, this is going to happen, this is where the conversation is going to go. But this person has left for the day, and he was like again shocked that what is this? I'm waiting here for the whole day. So then he's called the next day again, and then he goes and meets again to this person with whom he had the meeting. And this person says, who do you think you are? You think you can tell us? You think you're qualified enough to tell us, who come with years of experience, that we don't know how to take interviews? Who gave you the right? What qualifications you have? So he was, reprimanded, and this fellow felt shocked. I don't believe it. This is what he said. This was so sudden. He was so shocked, and he was like, I felt shattered, and I didn't believe this could happen. This was so unexpected. And then he decided that I'm going to be in the hospital. One of the remarks that the manager said was that, you don't have the qualities that are needed for the hospitality industry. You need to be kind, you need to be, always have a smile on the face, you need to be diplomatic. And you write this sort of a letter complaining about my interview process. He said, I'm going to I've decided I'm going to be, in this industry. I'm going to reach the top of this industry, and no matter what, I'm going to show you one day how well I did. And he did very well, of course. But you see, this whole idea of suddenness, shock, shattered came in different spheres of his life. Anticipation came in different spheres of his life. And he did beautifully well on Chelsea. Okay, so this is one idea. The idea of psychosis is anticipation, is avoidance, etc. But there's also this idea of compensation. If you read Boric, you will also see written absolute lack of fear. So they could control and hide. They could train themselves to not show their vulnerability, to not show their weakness, to not show their anxiety. Yeah. So this is also very, very inner stage of development. So, Gelsemium has a lot of issue with control, and the row 3 is very marked in Gelsemium. If you study Farrington, he clearly says that for diarrhea, it's a very, very useful, especially diarrhea after fright, not just aconite. Yeah. So you have to differentiate Loganiaceae and ranunculaceae very strongly. Yeah. Aconite is a very acute miasm. Gelsemium is a lot psychotic and prolonged. No, if the first case that we saw, her diarrhea is so chronic, it has gone on and on and on and on for years together. Was it life threatening? Did she die with it? Was it acute? Did it have that pace which you would expect with acute miasm? No, it didn't. So that is also a very psychotic feature. So diarrhea coming from excitement, from stage fright, from anticipation, or from an ordeal. So, like argentum nitrate. And you see copious yellow and also offensive diarrhea you will see in Gelsemium. And then, of course, Farrington says about paralysis. It's a universal symptom of this remedy that motor nerves are prominently affected, but it's functional paralysis, he stresses, okay? Indicated in paralysis after emotions of a depressing character. In hysterical women, Yakir writes that, probably it's one of the best remedy. I read it in Yaki's book, that when soldiers used to go off for war, and then their nerves are all, to avoid paralysis, you know, complete by like a sprite, I can't take this ordeal. I will not be able to. So I freeze in the moment. When they freeze, it's too much before going on to the border. Freeze. It's like shock. It's like paralysis. It's functional paralysis. I can't move. I can't do anything about it. Probably one of the very, very good remedies. Okay. So I think we can stop here. And I invite, if there are any questions and if there are any comments from anybody, or anybody would like to share their experience with Gelsemium, most welcome. Anything, anybody? Any feedback from the session? Did it make sense? Did it bring more clarity? Did it bring... Aparna wants to say something. Is there a way to unmute her,
Yes,
Tasmin?
ma'am. I'm doing it.
Yeah.
Yes, Aparna, you can say. You can unmute yourself and say.
Case which you had discussed the first case about the loose motions and all. The initially you had given that patient Gelsemium, and afterwards you had given that patient lactifluoratum. So how you shifted from a plant kingdom to animal kingdom? I mean, in the first case we saw that psychosomatic correlation was also there, and now after you got the result and then you are shifting to the animal kingdom. How?
Yeah, it's a very good question. And I can explain. So, uh, as homeopaths, I think what we are doing is we're trying to treat states in patients, right? So the predominant state, when she first came to us in, I think, I don't know, 2019, and she was, on Gelsemium for a couple of years, and she did extremely well. When she took a break, she stopped treatment, she was treated, she came back to me after, another couple of years. And that time when I retook the case, I should see the same state, right? I did not see the same state, the state of sudden shock, the whole plant sensitivity, it was all missing. And there was a new state that emerged. Now, that new state that emerged is from a different kingdom. So what? I mean, so even like we have to be open to a possibility that sometimes one remedy, the patient will need that one remedy, and that same remedy will last for the entire lifetime of a patient. He can be in the same kingdom, same remedy, same state, and maybe we just need to change potencies or whatever. But sometimes that old state gets healed completely and a new state emerges. And you have to see the new state and prescribe on that. She did not have the Gelsemium state. It was a new state. And that's how she was treated. Okay. All right. Then there are some questions on
Dr.
from,
Chinu is asking for differentiation with Nux vomica.
yeah. I have one, maybe let me share that. I have one slide which I think can help. You can take a screenshot of this also. So if you just kind of try and differentiate the key remedies within this family, uh, one way of differentiating them is through the miasm. Yeah, so you kind of can look at that. But you are asking for Nux vomica, isn't it, Taskin? Is she asking for Nux vomica?
Yes, ma'am.
Yeah, so if we just focus on Nux vomica and Gelsemium, Nux vomica is typhoid, very zealous, besides himself, very ambitious, wants to go achieve the world, cannot find rest, has to work, has to achieve, very typhoid like, yeah. Besides himself, okay, very pragmatic, very organized, and lots of effort. For example, as I said, no loss of business ailments from. It's I gave you a case example of Naxomic also. They will do anything to regain that position. Put their head and put their heart and head and soul and blood and sweat, everything to achieve it. Yeah. On the other side, Gelsemium is psychotic. There's a lot more anticipation. I have to keep my self control. There's a lot of issue of lack of self confidence, and then fear of losing balance, clinging to people. Yeah, so this is, I think, like a key difference how you can find. No? So, as I was saying, Gelsemium has more of this passive reaction of this family. Naxomica has more of the active reaction of this family. I hope it is clear. Then I think there is a question. So, where to study subclass and superclass? So, I can tell you, uh, last year we did like a 1 year program where we studied the entire plant kingdom from subclass 1 to subclass 6, not just of the flowering plants, but also of ancient plants, also of monocotyledons. So it's a very, very intensive course that's one place I think, and it basically integrates and amalgamates a lot of different schools of thoughts, etc. So that's one place which is, very, very comprehensive. So if you're interested, you can reach out to Dr. Taskin. But in terms of books, if I would recommend, so one book would definitely be Yaki's book on the plant kingdom. So it's Wondrous Plants, it's called. So that's one book that you must read. If you want to understand more about superclasses, Dr. Sankaran has already published his first book on superclass. So that's also a very, like, a book must have that you must read. Dr. Ria, have you seen results in pathological advanced case like sclerosis of aortic valve with diabetes, hypertension, etc.? Um, Today morning, and I had like these two interns who had come, and we saw this case of mitral wall, pathology and cardiomegaly, etc. And she's doing beautifully well. It was a case of Naja. She's on some background allopathic medicines, but doing extremely well. And then I think sometime back, we had this autoimmune session by Dr. Dinesh. No, I mean, these are the cases. A lot of these sclerosis, myasthenia gravis, autoimmune conditions have a very, very good scope in homeopathy. If there is a pathological damage already, if it's genetic or, it's end stage, maybe it could be more, we could improve the prognosis, not cure completely, but definitely we'll have some role to play, I would say. All right, I think we can wrap it up here, Taskin. Thank you so much, everybody, for your participation. Lots of interaction. I think this was a very, very interactive group. So thank you so much.
Thank
Bye.
you, ma'am. Thank you.
Bye. Bye. Take care.
Thank you, ma'am.
Thank you.
Bye.
Wonderful. Thanks, Bina. Bye.
Bye.